Get started. Hello, everyone, and welcome to the May BHA Town Hall. Thank you for being here today. Next slide, please. We're excited that you all took time out of your day to join us, and we have some exciting updates for you. Before we get started, I wanted to give an overview to all of our panelists today, just as a reminder to speak slowly for the interpreters and make sure that you speak clear. During this event, you can spotlight our ASL interpreters so they will appear larger on your screen, but we have also spotlighted them for all of you. So everyone should be able to see the interpreters right now. So I'll read this a little bit. If you do want to spotlight them yourself, you have the ability to change your view at any time. In the upper right-hand corner of your screen is a view button. Use this to toggle between speaker view and gallery view. You can also hover over the right corner of the ASL interpreter video and select pin if you would like to see them larger on your screen. But like I mentioned, you should be able to see the interpreters throughout the presentation. Next slide, please. Closed captioning has been enabled for this event. Click on the closed captioning button at the bottom of your Zoom window to turn on subtitles. If you need to change the language for subtitles, click the caret to the right of the button and choose your preferred language. If you're having technical difficulties, please direct message Rachel Childs in the chat for help. As you can see, we have quite a packed agenda today for you. We will start with talking about the purpose and intended outcomes of this meeting, followed by a little bit of housekeeping. And then we have BHA subject matter experts here to answer follow-up questions from the April Town Hall. Then a legislative update, a rules update and stakeholdering plan, and a guest speaker to talk about Equity Grounded Leadership Fellowship Program. And then a workforce update. And in the end, we will talk about how to get engaged and involved with the BHA, as well as follow-up topics from chat. As a reminder, town halls are not intended to take place of targeted stakeholder engagement opportunities. It is a space where we ask for your input and feedback on the broad topics we cover. All sessions are open to the public, partners, and community. We welcome your input on future session topics. Please utilize the Q&A feature or chat to submit any comments or questions during the town hall. We will record the town hall and post them on the BHA website, along with any documentation shared during the sessions. All right, follow-up questions from April. I would like to introduce you all to Megan Lee, who is the Crisis Program Manager here at the BHA. Megan, the question for you is, how will crisis services incorporate training to better serve people with intellectual or developmental disability?
Hi, thanks for having me. And I was really excited when I heard this was going to be a question because we're actually doing a lot in this space. So some of you may know that we're kind of overhauling our whole crisis sort of training approach to move all of the required trainings into a centralized location. The completion of that, about 40 hours of training, will confer like crisis professional status to the person who's completed that training. And they can run the crisis or clinical intervention at the walk-in center or in the mobile crisis modality. A huge part of that work is incorporating subject matter experts to help in the curriculum, actually do the curriculum development, including making the content, and then, asking for some support from other sort of community-based organization subject matter experts to contribute to some of the content development. And so our contractor to develop that work is partnered with someone who already is a subject matter expert in this particular area. And then they're using a few other organizations who have a specialty in working with people with intellectual and developmental disabilities, and also in the crisis space. And so that intersection is, it has a particular niche and a particular skill set that's required to interact with people in crisis who have intellectual and developmental disabilities. And so the creation of that curriculum is going to be really, really targeted on, how to not just interact with the person in the crisis situation, but then also how to make really adequate referrals post-crisis, because we found that that's where people really tend to slip through the cracks. So it'll be a really comprehensive overhaul of those training areas. We're also asking our mobile teams and their sort of administrative service organizations to have contractual relationships with agencies who specialize in a few different populations, and this is one of them, along with traumatic brain injury and some other kind of specialty areas that require a different set of training than what a crisis worker would typically undergo. And the purpose of these contracts is for the organization either to help respond to the actual crisis situation or to provide some expertise for that referral making process and help bridge the gap between why a person might be sort of entering the system through the front door of crisis, and then also think about getting them involved with longer term supports, whether that's clinical or more community-based supports. And so those are two initiatives that we have in the works to address this area that we know, like, the crisis system hasn't always done a good job of serving this population.
What an exciting update, Megan. Thank you so much for being here and sharing that out with everyone.
Sure thing.
Next up, we have Susie Morris, who is the manager for Child and Youth Substance Use Disorder and School-Based Services. Susie, the question for you is, does the BHA have particular plans for engaging with school-based providers and other school staff as the BHAs are being created and implemented?
Thanks, Megan. And I just wanted to say we have a thunderstorm that's blowing through and my screen keeps freezing. So if I'm frozen, let me know and I'll turn my camera off. Yeah, so I'm going to answer this question in two parts. First, I'll address what the BHA is currently doing around school-based work. And then secondly, I'll address the part in the question as to the BHA implementation and how that mental health program that actually has been providing support and services to schools for about 7-8 years now. And these services are provided by our participating community mental health centers. Currently, in fiscal year 23.
Susie,
yeah.
You keep freezing. You might want to try to turn your camera off.
Yeah, I was afraid of that. Thank you. Is that better?
So far, I think so. Thank you.
Okay. Should I start over? Was that really bad? I'll just start over again with from the beginning. I didn't get very far. So again, we do currently have a school-based mental health program that has been providing support and services to schools for 7 to 8 years. And these services are currently being provided by our participating community mental health centers. Right now, in fiscal year 23, we have 13 CMHCs who are participating, and we have 16 school-based mental health specialists who are outreaching schools in their particular catchment areas. I'm really excited that in fiscal year 24, we are expanding the program to 14 CMHCs and 20 specialists. And we do have a concerted effort to really bring more support to our rural communities especially in those 4 corners of the state. So that's really great news. As far as what we're doing in that program, we have specialists who are following a multi-tiered system of mental health supports, which is a framework that supports equity-based inclusion. The multi-tiered system of support is really a comprehensive framework that addresses academics, behavioral, and mental health needs of all students. And more specifically, the specialists are providing outreach, education, training, linkage, consultation, collaboration between their community mental health centers and the schools based on the particular needs identified by the schools. The specialists are providing direct guidance through implementing specific interventions. And those interventions are varied, but some examples of what those interventions may be are supporting schools with youth mental health promotion, suicide prevention, violence, bullying, and substance misuse. So that's pretty much a summary of what we're currently doing within this particular program right now. And then I'll address the second part. And as to what this work will look like once the BHAs are established, I unfortunately am not able to answer that today. With the delay of the BHA timeline, there will be more specific information about what that looks like, the implementation, and any impact as the BHA implementation is further developed. So there will be more to come on that soon.
Thank you so much for that, Susie. So much being done in this area. Appreciate you taking the time to be here today and share this out. Next slide, please. Okay, next up, we have several BHA updates. Next slide. The first one is the 2023 legislative session debrief. So I'm excited to introduce Andrea Jones, the Deputy Policy Director. Welcome, Andrea.
Thank you so much. Can we hear okay? I know we're also in the middle of a thunderstorm down here. So, okay, fair enough. I will try to speak slowly and clearly. My name is Andrea Jones. I use she, her pronouns. I am the Deputy Policy Director at the BHA. I'm going to take us through a quick recap of this year's legislative session and some of the bills that made their way through. I know we have a packed agenda, so I will try to get through it. And then we do have some contact information for the policy division on the slides at the end. So that is a good way to do follow-up should it be needed. So the BHA this year ran one department agenda bill, House Bill 23-1236, which was about implementation updates to the BHA. It started primarily as technical modifications to our authorizing statutes from previous years. That was a huge piece of legislation. Obviously, we didn't get every single piece correct or fleshed out in the way that it needed to be. So there were a number of technical adjustments that needed to be made. To our bill as proposed, there were 29 amendments. On the slide in front of you, you can sort of see those broken down into buckets of what those technical adjustments were. Primarily focused on garnering greater community and co-created input from around the state for what these systemic implementations should look like, along with the delay of some key provisions to ensure that we have that buy-in, that co-creation, that we're looking at setting up these systems in a way that makes sense and that is going to work for the people of Colorado. We delayed the launch of the BHAs. I know that's the Behavioral Health Administrative Service Organization, which ultimately it was in July of 24. Now it's another year out for those to actually come online. In the meantime, the service delivery is going to look a lot like it does now with some minor programmatic adjustments. Along with that, we have several rule volumes that are moving forward. We've been doing a ton of stakeholdering around this around the state with Tom Miller and team. And the provider rules will go into effect January 1 of 24. So those were delayed until an implementation date of that. Those are currently being stakeholdered, and there are many opportunities for that as well. Again, good contact points at the policy team if you need more information on that. The 1236 also codified an agreement that the BHA would supplementally cover costs of the mobile crisis response systems, especially in more rural communities, on an interim basis while the full system is being implemented. And it delayed the implementation of some of the 72-hour hold provisions. The bill carried no cost because it was a technical adjustment bill, not a substantive additional programming. So next slide. Okay, so these outside of our bill that we just sort of ran down, these were some bills touching on mental health issues, substance use issues as adjacent to the BHA and our programs and what we do that we thought it would be helpful to mention or call out. House Bill 23-1003 is the school mental health assessment. Basically, it's a BHA program where we're going to screen students in schools for behavioral health needs and refer those students to appropriate services. That is, as noted, a 24-25 fiscal year implementation. House Bill 23-1088 is going to provide free behavioral health services to veterans who are living in, veteran community living centers. Thank you. So many acronyms, I know, and I'm terrible about that. So if I miss one, please just pop it into the chat and I will make sure that we get those parsed out for you. Currently, veterans that are in those living centers don't have access to the full spectrum of services. So this was a way to provide some of those much needed services to this specific subset of veteran populations. House Bill 23-1138, procedures related to adult competency. This helps to, it's a very technical piece of legislation, but it helps to clarify and align the pathway for individuals who are being evaluated for competency within a criminal justice system to proceed to transition into the civil side of things that is not as criminally justice adjacent. Okay, all right, next slide. Let's do, yes, perfect. House Bill 23-1268, the private treatment of out-of-state defendants. There's basically an agreement, the interstate compact, that drives how states talk to each other and administer services for criminal justice involved populations. This bill in particular allows providers to start services, start assessments, start treatment for the patients, to basically triage that need prior to all of these technical requirements of having to register with the Interstate Compact Administrator and some of these back-end paperwork processes that take a lot more time, recognizing the fact that we need to address the person first, and then sort of the call of the Interstate Compact is hand in hand with that, but this more closely aligns how that service delivery should actually look for this specific population in need of services. House Bill 23-1269, extended stay and boarding patients. So unspent child welfare dollars will go to support high acuity behavioral health treatment and services that are delivered to children. The BHA is developing a framework for data collection around these boarding and extended stay involved youth, and determining how that information, how we can use those data points to further identify gaps and really solidify our performance metrics across the behavioral health space, which is one of the things that we are called to do. So this bill helps us do that, which is why it's included on this rundown. And then I think those were the bills that affected us mostly. Again, these are our legislative contacts. Casey Badmington, who is currently on a well-deserved bit of time off after the legislative session this year, is our legislative affairs officer. She's a wonderful point of contact. Ryan Templeton is our division director at Policy and External Affairs, and then myself, Andrea Jones. Any further information you want on any of these bills, what they did, the BHA implementation bill itself, timeline adjustments, feel free to reach out to any of us. We are fairly responsive through email and happy to answer any questions you may have.
Thank you so much, Andrea. So many updates, very exciting things happening. So thank you for sharing all of that out with all of us. Okay, next slide. Next up, we have Victoria Lasky with our licensing SafetyNet team. And Victoria, are you on here?
Yes.
There you are. Welcome, Victoria. Thanks for joining us. Victoria is here to share an update on the rules and the stakeholder plan.
Thank you, Megan, and good afternoon, everyone. My name is Victoria Lasky. I use she, her pronouns, and I am the SafetyNet Associate Director at the Behavioral Health Administration within our Quality and Standards Division. So we do the licensing, designation, and approval for behavioral health providers. And in many ways, this update is part 2 of Andrea's legislative update. So because of some of those timelines that changed, because of the BHA implementation bill, we are having some timeline adjustments to our rules for provider licensing, designation, and approval. So I'm going to work through this slide a little bit backwards. In the law, our new deadline is January 1st of 2024. That was originally July 1st of 2023. So this is an additional 6 months to get these rules approved. And the process for that looks like 2 reads at the State Board of Human Services, which is our board that gets to approve our regulations. So with a January 1st effective date, we are expecting to go to the State Board of Human Services in September and November to present these proposed rules. And in order to get that done, we need to undergo a legal review process with our Attorney General's office starting July 1st. So I say all that to preface the really exciting news that we are able to reopen stakeholder engagement for these provider rules through June 23rd. So we began this earlier this month. I believe we had our kickoff on May 10th, and I know I see a lot of familiar names on the participants list today. I know a lot of you have been very involved, and just want to say really appreciate all the time you're investing in talking to us. And I think that this stakeholder feedback process is allowing us to make a stronger set of regulations, one that's going to work better for providers and for the community. So we have a full calendar of events in May and June. These are both virtual and in person to cover all chapters of proposed provider rules and also include some targeted stakeholder groups. I do have a slide in a little bit that goes into more specifics about these opportunities and where to find them. We are also accepting written comments on the rules that can be received through our inbox that we monitor daily. We have an email inbox that the SafetyNet team responds to and receives feedback from. And we also have a survey where feedback can be submitted. We are accepting feedback until midnight on June 23rd. At that time, we will have 1 week to incorporate feedback as appropriate before we send those rules off for their legal review. All of the updated rules chapters, including our behavioral health entity license, our SafetyNet provider approval, and our 2765 designation for involuntary services, are now available on our webpage. Next slide, please. So this slide is just that information represented in a little bit of a different way. You can see those timelines, those dates that I mentioned with the rules effective in January. our first and second reads at State Board in the fall, our legal review going through the summer, and currently right now diving into stakeholder engagement and getting feedback on our proposed regulations. Next slide, please. We have a great one-stop resource for all things regulations, provider rules, our laws and rules webpage, which is this link that you'll see in the slides. What you can find here are our updated rule chapters. We have person-centered summaries in English and Spanish that explain what do these rules mean to a person who is receiving services. We have information about how to submit written comment on the proposed rules, including that inbox and survey. Our rules stakeholder events calendar, you'll see we have at least one event almost every day through June, so that there are many opportunities to engage with us about the rules. And we have a variety of types of opportunities. Some are a little more presentation-based and educational, walking through those proposed regulations. I won't hide the ball. They're about 400 pages total, and we are very happy to walk through those and explain those in a more digestible manner. We also have a number of opportunities that are more discussion-based, so but a lot more listening than speaking, with some guided discussion questions. We also have a number of licensing transition resources, including a behavioral health entity fast fact, a flow chart to determine if your agency would be considered a behavioral health entity, testimony and response from the State Board of Human Services, and we have plenty more to come, as we know that there is a desire for technical assistance around this big change in the behavioral health regulation system. Next slide, please. All right, so this is the really exciting part. We have a number of upcoming stakeholder events. We have held 3 in-person events already, one in Denver, one in Breckenridge, and one in Fort Collins. We were just there yesterday. And we have upcoming sessions in Canyon City, Durango, Grand Junction, and Pueblo, really wanting to get to all corners of the state to hold these in-person listening sessions. So those are more of those discussion-based. We sit down with you all, whoever would like to attend, for a couple of hours and listen to what are your questions and concerns regarding these changes to provider regulations. We also have a number of virtual opportunities, including rule town halls, where we will have detailed presentations about rule chapters. We have the SafetyNet chapters 3 and 4 town hall tomorrow. We have our lived experience sessions, so discussion with individuals with lived experience about their experience with behavioral health services in Colorado. And that one's much less technical and much more discussion based about what is feedback provided about those about services received in the behavioral health system. We do have 4 of those sessions. 2 of them are English language, 1 is Spanish language, and 1 is American Sign Language. We have office hours, which is a virtual open time to bring questions or feedback. We had one of those earlier this afternoon that was very well attended, had some great discussions there. We have some provider specific sessions. Oh, and I see some feedback that the office hours were great today. Love to hear that. Provider specific sessions for substance use disorder providers, 2765 designated providers, and withdrawal management providers, as well as others. So I can go ahead and drop that one-stop shop link into the chat so that you all have access to that, and you can check out that calendar and take the opportunity to engage with us. Thank you.
Thank you, Victoria. Did you see there is a question in the chat asking specifically if there will be any in-person sessions in El Paso or Colorado Springs?
Yes, thank you for that question. So as you can see, we have a pretty limited time to do this stakeholder engagement. And so we were trying to really hit all corners of the state and do not have one that is specifically in El Paso County. However, we do have a couple in the surrounding areas that are coming up, including Canyon City and Pueblo. Unfortunately, we're not able to get to all of the locations that we would really like to, but with the schedule schedule we have, we're trying to hit all different regions of the state, and would love to invite you to virtual opportunities if those two are a little too far for you, but we do have those two in the general area down south there.
Thanks, Victoria. And I will add, I had the opportunity to participate in one of the first in-person sessions. And if you all have an opportunity to attend any of these in person, they truly are listening sessions, open dialogue, really great opportunity to share your feedback and ask questions. All right, thanks again, Victoria. And we can move on to the next slide. All right, I am very excited to introduce you all to Ebony McClinton, who is here from the College of Behavioral Health Leadership, Ebony Chambers McClinton. Ebony, thank you so much for being here with us today. It is quite an honor to have you joining us. So I will pass the floor to you.
Thank you, and it's a pleasure to be here. Hi, everyone. Thank you, Megan, for the introduction. I am excited to share a bit of information about the Equity Grounded Leadership Fellow Program, and so I'll just be sharing a bit about the program, and the applications are open now, and we're just excited to share a little bit about it, as well as some of the requirements and structure of the program. We can go to the next slide. Thank you. So what is the Equity Grounded Leadership Fellow Program? And it's an 11-month program designed to support behavioral health leaders and those in cross sectors of that. So anyone supporting well-being and support of anti-racism, equity, and intersectionality to really support system transformation. The goal of this is to see system transformation across the United States and in many of our communities. And so this program really has a goal to support leaders with understanding how inequities are perpetuated in the behavioral health systems. So really understanding the history and how it shows up in our present day systems. There's a piece around supporting transformational leadership, and that really just is designed to help leaders step into their own voice, courage, and power. We recognize that these conversations, while not new, are still really difficult to hold and to ensure that leaders are equipped. Part of this program really supports leaning into that voice and speaking up against behavioral health injustices and system inequities. It also supports leaders in being agents of change and really working to unravel these inequities and racism, as well as take measurable action. We can go to the next slide. Thank you. So these are the principles of change and really the foundation of the program. It really provides an opportunity to understand how those different systems I just shared show up in our behavioral health system, but also what does it mean to practice intersectional allyship, to understand the different identities that we all hold and understand how to speak up against and for our communities, not against, but with our communities and for our communities, and against practices that cause the disproportionality and disparities that we see. There is also a goal to understand equity frameworks, culturally responsive practices, as well as new behavioral health approaches that really meet the needs of our community. The next one is really important because it really, someone was speaking earlier about co-production, and I just appreciate that, you know, we have a saying in our community, I'm someone with lived experience. We say nothing about us without us. And that just means that we're no longer creating systems and developing systems without those that are impacted by it. And so this engages in co-production and community-driven practices, really allows us to understand our communities better and build those systems with community. And then that last one around demonstrating transformational leadership. So really leaning into the vulnerability and using that intersectional allyship to operate within that space. And this is our pilot from 2022, and they just finished up their program in 2023. We had 5 behavioral health leaders in Colorado participate, and we're super excited and hope that there will be even more participating in this 23-24 cohort. We launched last year in March of 2022 and continue this work. Equity is not an 11-month program. It's an ongoing learning journey. And so we continue to have equity grounded leadership learning collaborative that allows us to still come together monthly, talk through any challenges we're continuing to experience, as well as brainstorm and share new ideas through the ECHO model, which allows us to bounce ideas off of each other in a safe space and continue to learn together. And this is just, the next couple of slides have just a few quotes from fellows that participated in the program and just shared their experiences around being within community with others and how that can be restorative and how that was restorative for them and how they really had an opportunity to talk about racism and queerphobia and how that was healing. We have a component of mentorship, coaches, and advisors in the program. And so this fellow shared about how that mentorship was really life-changing for them. We hand select coaches, and one of the many areas around this program that I really appreciate is that it is developed with the fellows that are joining that cohort in mind. So there's no cookie cutter approach. We really individualize, and that means that those coaches are really matched with leaders based on the coach's strengths and the fellow's strengths. So not everyone receives the same coach. It's really based on strengths and background and skills. These are just some of our outcomes from last year's cohort. We did see a statistically significant improvement in all 5 principles of change, which I shared just a bit ago, from the pre-program to post. We're also very much so big into making sure that we incorporate feedback throughout the pilot, and we did that and improved the program, and excited about even more of those changes being implemented into this new cohort. And then fellows just sharing that they found support and guidance to be very impactful. So I shared this as an 11-month program, and this really just walks you through those, the different months where the cohort begins with forming, as well as understanding your own needs as a leader. We have a 2-day in-person kickoff that will be held in Sacramento, where we'll close up somewhere on the East Coast. That's also that time where we'll have virtual meetings as well. There'll be coaching. There is a collaborative project, an opportunity to implement the work that you're learning in your own communities. And so with that means that's where the project implementation happens with an advisor, and continued meetings, coaching, development of your own individualized plans, and then continued project implementation post-program. I mentioned the advisors and the coaches. I'll share also myself as a part of the program and just as a facilitator and as also the director of the program. We have another lead facilitator. We also have a director of operations, all as a part of the support for the fellows that are participating in the program, as well as a strong peer-to-peer component of peer-to-peer support. But you are not alone in this equity journey, and we want to make sure that there's a strong foundation of support along the way. So I think I just saw a question that might have popped up in the chat around, are there requirements of who can join? And right on time for who should apply. And so current or emerging behavioral health leaders of all levels. I personally don't define leadership by way of title, but really about one's ability and desire to see change in their community and plan and put a plan together to make that happen. And so someone who's open, willing, and prepared to engage in those change efforts. We also are looking for folks that are within the intersections of behavioral health. So emergency medical services, law enforcement, first responder organizations, community-based organizations. So all of those different intersections of the work that we do. I see how many hours per week should be set aside if they were accepted into the program. And we anticipate, based on your own individual learning and time, a minimum of 12 hours a month, up to 18 hours a month, depending on the different plans that you put into place for yourself, because some of this will be an individual component. No problem. We can go to the next slide. This is program cost. And so this is the total program cost for the year is $11,800 per fellow. It does include the cost of the curriculum, the facilitation, coaches, and advisors, as well as 3 years of CBHL membership. It does not include the travel for the in-person meetings that happen at the beginning of the year and at the end of the year. And there is options for payment. But what's most exciting, and I think we can go to the next slide for that, is that there are currently 3 committed sponsorships for behavioral health leaders in Colorado. So there are an opportunity to apply for sponsorships, and we wanted to make sure that the community had that information. And while right now we currently have 3, we are still hoping to have more sponsorships, and that will continue hopefully to come in. And so don't be deterred by the 3 that's available. We encourage everyone to apply, and we hope that we can make space for everyone through this process. Let me see, I think there's some more. I've got some, so now for questions, and let's see, will the equity program be offered again next year? Yes, that is the hope, that we offer this every year. And I think, oh, and then who all is available to apply. And I shared that in the slides. So anyone who's in the behavioral health sector and intersections of that. So EMS, law enforcement, community-based organizations that intersect in any way with behavioral health. Any other questions? No problem. All right, Megan, I think that's it for me.
All right, Ebony, thank you so much for a fantastic presentation. What an amazing opportunity. So thank you for sharing about this program.
Thank you so much.
Okay, it doesn't look like there's any more specific questions for Ebony, so we can move to the next slide, please. And next slide. Okay, next up is a workforce update. We have Wendy Zimmerman here to share out an update for you all. Welcome, Wendy, and thank you for joining us.
Thanks, Megan. I am excited, and I'll keep this really brief. Some recent things that are happening on the workforce side. We are awarding $4.5 million in recruitment and retention grants. When I put this on the slide, I thought that we had already made public the award list, but I received an email this morning saying that we found out that we had to do one more layer of checks on the awards before they can be announced, but we're that close. We're so close. We have a career pipeline grant that we expect to open within the next couple weeks. So be watching for that. We'll be sending out information through the BHA's communications channels. That'll be $4.9 million for projects and initiatives that support career pipeline work. So bringing people into the behavioral health career pipelines. In July, we will be opening peer support grants. That was $5 million that was dedicated in SB 22-181 for strengthening and expanding the peer support workforce here in the state of Colorado. We also announced, I think in our last town hall, that we have 2 other efforts around the peer workforce. One is a quarterly collaborative meeting that's open to everyone working in the peer support space. The next collaborative meeting is July 27th at noon, and I've put an email here if you'd like to be added to our contact list for that. We also announced that for the next 18 months, we would have a peer support steering committee that would assist the BHA in carrying out some of the other directives in SB 22-181, including some standards for the peer profession and some of the other specific things that were called out in that bill. This is a group of 15 people from across the state that will be advising the BHA. We accepted applications through the month of April. They're currently under review. The peer support workforce came through in a big way. We had 72 applications for 15 spots. So you gave us a really hard job, but we appreciate it. And we expect to announce the formation of that committee in early June, and they'll begin their work in July. So those are some of the things happening on the workforce side that we're excited to share with you. And if you have follow-up questions, you can use that email and it'll eventually get to the right person so we can answer your question. Thank you.
Thank you so much, Wendy. Again, more exciting updates. So this is all really great opportunity and updates as well. Thank you for this. All right. And for our next town hall will be Wednesday, June 28th at the same time, 3 to 4 p.m. Mountain Standard Time. Upcoming topics, we keep this running list of topics, so it could be any combination of these, or it could also be topics based on need or requests that come up during the month. So upcoming topics will always be follow-up questions, as well as behavioral health ecosystem, whole person health defined, and care coordination. So those are some of our upcoming topics. And please feel free to reach out if you have specific requests of topics you would like to see covered at an upcoming town hall. Next slide, please. Here are some reminders of some ways that you can get involved with the BHA. We will continue to share additional engagement opportunities as they come up as well, but you can subscribe to the BHA's monthly newsletter. There's an open feedback form on our BHA website. And then we also have a calendar of events that is open to the public, and this includes monthly provider and crisis convening, monthly BHA town halls, the BHA Advisory Council meetings, and the Behavioral Health Planning and Advisory Council meetings. And if you wouldn't mind putting into the chat any additional topics you would like to see highlighted, I will also put my email in the chat and you can reach out to me directly if there are additional topics that you would like to hear about at the next town hall. Next slide, please. And you can scan with your phone this little emblem right here for more ways to stay connected to the BHA. I was just going to look really quickly before we close. We still have a few minutes to see if there's any additional questions in the chat. Looks like most of them have been answered. Amy, I see a question for you, and unfortunately, Megan Lee had to jump off. I am going to put Megan Lee's email in the chat as well for any additional questions that anyone had on crisis services. She's happy to answer all of those for you as well. Right, and it doesn't look like I'm seeing any additional questions pop up. So I will add my email for you all to reach out with any requests for town hall topics. And thank you for spending the last hour with us listening to BHA updates. Thank you for being here and all that you do in the community. I wish everyone a great rest of your week, and we'll see you next month.